Previously on ER.
I've been having a problem with Dr. Romano.
Why didn't the genetics clinic suggest this medication?
Well, it's brand new. It's still part of a clinical trial.
Do I need to fill any of this out?
I wouldn't bother. He's not a candidate for the study. Here you go.
Breaking research protocol could damage the hospital's funding.
So you agree with him?
No, I see their point.
Doug, don't walk away. Doug.
Hey, Jerry, have you seen Doug?
Yeah, he dropped off some charts, said he was going up top for coffee.
Up top?
As in, keep your coat on.
I missed you this morning.
I tried not to wake you. Figure at least one of us should get more than 4 hours of sleep.
I love you. You know that?
Yes, I do.
Doug, what's going on? You all right?
Well, I'm not thinking about jumping if that's what you're afraid of.
Well, that's good because I'm attached here, so you'd have to take me with you.
All this just about helping the kid.
Well, what?
You and me getting into it.
Hey, that's over and done.
It's not over and done for Mark and Carrie.
Now, you don't know that. They both already said that they don't want to make a big deal out of this.
They have to do something
What?
to prove that they never wanted a pediatric attending in the first place.
Doug?
That's not fair.
No. Hey. You put the patient first. And that's what we're supposed to do, isn't it? Huh?
You're good to me, you know that?
Yeah, I know that.
Largely, it's been innuendo, the slightly inappropriate phrase at the slightly inappropriate moment. I'm not sure you'd even consider it sexual harassment.
Well, if you could give me some specifics.
No, one of the more ridiculous ones was when he spoke of sniffing my tailpipe.
Excuse me?
Well, I just parked, and he said words to the effect that had he known it was my car, he would have sniffed my tailpipe. And I asked him what he was talking about. He said something like, oh, I thought we were talking about sex.
But you weren't.
No, of course not. I was coming in to do a gastroplasty.
Did Dr. Romano ever give you any reason for terminating your fellowship?
I was led to believe that he didn't have to give me a reason.
But he didn't sponsor anyone else and the funding didn't go away.
No.
So why do you think he did it?
Well, I suppose he could have been punishing me. We went out to lunch once. He laid his heart on his sleeve, told me he found me very attractive, and asked if we might go out together on a date.
And how long after that did the fellowship end?
A matter of weeks. But we don't know for certain if the two are related, do we?
Well, that will be for others to decide.
What others?
If a full investigation goes forward.
And how will that be determined?
Dr. Weaver, Dr. Corday. You just ordered up the high cholesterol breakfast, 3 eggs, pigs in a blanket, and biscuits and gravy. May I join you?
Yeah, unfortunately, we just finished.
Oh.
Yeah, drains to pull, that sort of thing.
Oh, well, then I guess I'll have to administer CPR to myself. Doctors?
Yeah.
I've been sitting for 3 days. I would rather walk if you don't mind.
Well, I'd rather you sit, man. Okay, we're just going right in here. Hey, Carol, I got us a customer. SOB with the cough.
Who are you calling a son of a bitch?
No, man, that just means shortness of breath.
Okay. Let's get you seated on the gurney and take off this coat.
No, it's cold in here.
We'll promise to give you the
Really,
coat
if
back
you could
when
just
you
give
leave.
me some medicine.
You need to help us out.
Oh, Sparky, get back up here.
You're not allowed animals
Well, then just give me some cough medicine and I'll get out of your way.
Tell you what, why don't you let Malik take care of Sparky while I quickly examine you, okay?
Are you a dog person?
Yeah, sure.
Okay. Any fever?
Hey, Spark.
No.
Coughing up any yellow or green sputum?
No.
All right. This might be a little cold. Okay. I hear a few crackles. I'd like to get a chest x-ray. Make sure you don't have pneumonia. Alice, you're a smoker?
Oh, yeah. Breaks up the boredom out there on the road. I just drove straight from Albuquerque.
Why?
I don't know. If I'd known it was this cold in Chicago, I would have gone straight to Miami. How much is this x-ray going to cost? I don't have the insurance. I don't have the money.
Alice, we're a county hospital. If you can't pay it, subsidized. You have any family in Chicago you'd like us to call for you?
Don't know a soul in Chicago.
Okay. You stay right here. Keep an eye on Sparky, and Malik and I'll be right back.
I'll order a portable x-ray.
Good idea. I don't think radiology's going to want to deal with Sparky.
Carol, medical records. I sent these charts up for review.
Yeah, we sent them last week.
Then why'd they come back?
It's like they said, for review by the interim chief.
That's you again, right?
Thank you for straightening that out, Malik.
Richard Tuggle, 35, complains of 20 minutes of heavy substernal chest pain with nausea and diaphoresis.
Felt okay this morning.
Coming through.
I'm sorry, I'll come back later.
No problem. Get up. Go. Here we go.
BP's 140/88, pulse 90. Chest pain was relieved by 2 sprays of nitro. That's all she wrote.
CBC, Chem 20, cardiac enzymes. Here, come out of that. And 12 lead. Have you had pain like this before?
Never.
Any history of heart disease?
No.
Okay, high blood pressure, diabetes?
No, I'm really healthy.
Carrie, when you're free, Doug's waiting in the lounge.
Okay, I'll be there in a minute.
Pulse ox is 99 of 2 liters.
We're not shoveling snow, were you?
Yeah, work at home. Telemarketer. So what is it? Have a heart attack?
Well, you're a little young for that. We'll do some blood work and monitor your heart for a while. Don't worry, we'll figure it out.
I hear an ejection murmur.
I hope not.
Carter? What are you doing?
Dr. Anspaugh. Meet Dudzik, Hiltzik, and Strauss. Second years, patient doctor class. Need some?
Well, I was hoping you could give me some time, but never mind. Where's your student, Miss Knight?
Surgery rotation.
Right. Never mind. Sure you don't want a cup of coffee?
No, I'm not having any trouble staying awake. Okay. So it's a verdict.
No big verdict. We agreed that we're going to keep this quiet so that we don't jeopardize hospital funding.
But Mark and I want some assurance this won't happen again. So, anytime you want to prescribe Schedule II narcotics, morphine, Demerol, Dilaudid, fentanyl, methadone, we want to co-sign the order.
That's it.
That's it.
Okay. Well, if it'll settle things down, I'll agree to do it. And whether you believe me or not, I don't have some compulsion for breaking the rules. Sometimes I get in the way of helping a patient, but if you'd seen how much pain this kid was in, I think you would have done the same thing.
Doug, we have seen that kind of pain. Dr. Ross, Carol needs you in curtain 3.
Thanks, Jerry.
His contractures have been so severe, worse than anything I saw with Michael, and his seizures have increased.
Joy, come sit.
Dr. Julian wants to admit him, but I just can't do that.
Roger, Julian?
He's a doctor up in genetics.
Yeah, I know him.
Joy spoke to him this morning.
Michael, my oldest, was in the ICU his whole last week, hooked up to all those tubes. I know Ricky doesn't have much time, but I just can't do that to him.
Can we keep Ricky here?
No, please, I just want to take him home.
Okay. I'm going to talk to Roger, but I think we should arrange for something called PCA, which is patient-controlled analgesia.
We would hook Ricky up to an IV that would deliver pain medication to him at home.
Now, obviously, you're going to have to control it.
Will it be stronger medicine than what you gave me before?
Be Dilaudid or fentanyl.
Okay, I'll do whatever it takes, Dr. Ross, just so we can keep him at home. I know you probably won't know the difference, but, you know.
It's okay. We'll let you know as soon as we can set it up, okay? All right. I'll go find Roger. You set up an IV. All right?
Yep.
Getting near the end.
If the survival rate is the same, then why not do the lumpectomy and save the breast?
Well, because with a modified radical mastectomy, you can save the patient.
Although a lumpectomy can get around the tumor.
And then you do radiation therapy,
Yeah,
right?
and there can be severe side effects.
Yeah, well, there can be with removing a breast.
Hey, look, I'm not discounting the psychological impact here.
Actually, I think you are, just a bit. You'll discover most male surgeons find it relatively easy to just lop off a breast.
Elizabeth, come on, that's cliche, don't you think?
Yeah, because it's true. It's a really personal decision this woman has to make. She's going to worry about her sexuality, her self-image.
Listen, a patient comes in here with cancer, I say we cut it out.
See, even there, you think of her in terms of being a patient, not in terms of her being a woman.
You know what? Okay, it's not that complicated.
Now, you don't want it to be that complicated. Just cut to the chase, so to speak.
Well, isn't this a scrub fest? Hey, Peter, you mind if I borrow your intern? I got stuck doing an appy.
No, not at all. I've only got a biopsy. Lucy, you're with me.
Thanks, appreciate it.
You really need my assistance on an appendectomy?
Of course not, but I'd love the company. So, how was breakfast?
It's coffee, actually.
Women never seem to eat breakfast anymore, do they? Now it's just coffee or sometimes maybe a muffin. Why is that? Are they worried about their weight, or are they worried that they'll get a reputation for eating like a horse? Or
I really couldn't say.
can you say what people are talking about with Carrie Weaver over their coffee?
You can stop playing games, Robert. I know what's going on. I know someone's accused you.
Falsely. But if someone like Carrie Weaver starts rooting around and decides she's determined to dig up something, you know, well, that's how people get hurt.
That's true.
I mean, for instance, what if it came out that you were sleeping with Peter Benton while you were his intern and he was your supervisor in a position to evaluate you, which I'm sure you're aware is a very big no-no.
Come on. Peter and I were together before I was his intern.
Yeah. And you made Anspaugh aware of that, right? Because that's grounds for dismissal. I mean, not for you, of course, but for Peter, Dr. Benton, which would be a real shame, considering how much work he's put into getting where he is.
You wouldn't dare.
Oh, well, I wouldn't like myself very much if I did that, would I? Anyway, it's not really in my hands, is it?
Yeah, films are back on Alice Presley, and she's antsy to go. I told her I remember some meatloaf for Sparky.
Thanks, Malik. Hey, Steve.
Miss Hathaway, always a pleasure. I've kept these up so you can see for yourself.
And as you can see for yourself, there is no evidence of pneumonia. There is perhaps a slight increase in bronchovascular markings, which could be smoking-induced, although it's more likely she simply has the flu. Not unlike half the techs in our department. In other words, what we have here is essentially normal chest film.
I'd like a VQ scan.
What makes you think she has a PE?
Well, she's a smoker, she's hypoxic, she's been driving for 18 hours, putting her at risk for blood clots in her legs.
What's her heart rate?
85.
Respiratory rate?
20.
Any calf tenderness?
Not really.
Well, nothing you've said so far suggests pulmonary embolus.
She has pleuritic chest pain.
So does everyone with bronchitis.
Look, I know there isn't any hard evidence. It's just a feeling I have.
Well, unfortunately, I cannot authorize an $800 test based on your intuition. Your patient has a cough. And no insurance, I might add.
So that's what this is about? Payment?
No, although the hospital does like to cover its expenses.
I'll pay for it.
Your checkbook is my command.
Thanks, Steve.
1 VQ scan. Coming up.
Carol, I got a couple more hackers for you. I'm going to go ahead and stick them into exam 2.
Oh, no. It's not ready yet.
Yes, it is. Your patient just left.
Alice Presley?
Is she a little nuts? She was talking about going to walk her Sparky.
Oh, God.
So I promised Aunt Spot review charts for him. Am I a sucker or what? You know, you don't have to agree with me. You okay?
Yes, it's slippery, but I'm fine.
Good luck, Mark. How's he doing?
Oh, pain-free, normal sinus, no ectopy?
It's all good, right?
Yes, but I got some of your blood work back, and I'm concerned because your cholesterol is 465.
That doesn't sound good.
It's not.
Do you have a family history of high cholesterol? Did your father or any male relative have heart trouble in their 30s?
I don't know.
Because there are inherited conditions which run in families and can cause high lipid levels.
So you might want to check because they can put you at risk for a heart attack at an early age.
Well, I can't check. I was adopted. I don't have a clue about any medical history.
I'd like to admit you then so we can start you on a cholesterol-lowering agent and do a complete workup.
Alice, wait! You need to stay for one more test. I really can't. My Annie calls. You don't want to get stuck on the road and be sick, Alice. No, you don't understand. I can't leave the pups out in the cold. It's okay. You can bring Sparky back in. I won't tell anyone.
No, you really don't understand. It's not just Sparky. I didn't start out to collect them or anything. It just kind of happened.
Come on, Jules, we did our residencies together.
Doug, the old school tie's not going to work. I hated my residency.
There you go, so did I. I know Ricky can't control his analgesia, but the mother said she's willing to do it.
Look, up in genetics, we prefer to admit these end-stage kids. We don't have a lot of experience with home care.
We do it with cancer kids all the time. They send homes and hospices.
Well, maybe oncology can help you out.
I don't have time to wait through that department. This kid's in bad shape. He needs it.
Doug, look.
Jules, come on.
Look, I'll talk to the rest of the team about it, okay?
All right.
We meet day after tomorrow. I can let you know.
Ricky doesn't have till the day after tomorrow.
I'm sorry.
Ouch, you're poking too hard.
Stressed up, you weren't.
These are the anterior chains, and these are the posterior. As you examine, ask yourself, do the nodes feel like BBs, like peas, or sour balls? I got 2 BBs.
I got 1 BB, 1 sour ball.
That's a quick goofing.
I don't know. It doesn't feel like a BB. It's not a pea.
All right, it can be tough to estimate the size at first.
BB and a P, right?
You got any night sweats? Any weight loss?
Jeez, what is this?
Have you?
No, I feel fine.
Noticed any enlarged nose anywhere else?
Oh, wait a minute, you're kidding, right?
No, nothing.
I'm sure it's nothing to worry about. I might get another doctor to take a look, though. Maybe do a biopsy.
A biopsy?
Hey, listen, I'm Mark Green. I'm sorry, I don't know your name.
Mobilagic Cabo.
Listen, you've obviously done something to your back. Why don't you let me take a look?
No, it's been like this for a long time. I'm all right.
Yeah, it might be a slip disc. Let me take a look. Come on. It won't take long. Just sit down right here. So, did you just start here recently?
It's been several months.
Really? Haven't seen you around much.
I worked on other floors.
Well, I'm glad to have you down here.
Thank you.
Closing the curtain for a little privacy. Okay. You can go ahead and take your shirt off now.
No, please. Stop, please. No. Stop it, please. No. Stop.
I'm not doing anything.
Stop it now! Stop it! Stop it!
It's okay.
Stop it!
It's okay.
Stop it! All right?
Malik, do you need some help?
No, I'm good. I'm just going in here.
Hey, how'd you do?
It's all good. They like cheese sliders. Sure we ain't breaking the rules?
No, Malik. Sneaking dogs in through windows and feeding them cheeseburgers isn't breaking the
Did
rules.
you say cheeseburgers? That's their favorite.
Hey, shut the door, shut the door! Please don't ask.
All right, I need to talk to you just for a second outside.
Yeah, Malik, you okay in here?
Oh, he's doing great. The pups love him.
All right, I'll be right back.
Oh, and after they eat, that's usually when they need to go outside. Make a little poop.
So genetics failed on us. I'm not going to be able to get a PCA for a couple of days.
Well, maybe I can arrange it through the clinic, you know? I'll call one of the home health care agencies I've worked
worth
with.
a try.
Jerry, did you find out about that guy, Mobile Laje?
No, housekeeping hasn't called back yet.
Yeah, I heard about that. What happened?
We just flipped out. I hadn't even started the exam.
Oh, you know, Rachel called, and she said she's going with the purple frames, whatever that means.
Poor Rachel. She just found out that she needs glasses. She couldn't see the blackboard at school.
Oh, yeah, I hate it when that happened. I felt like such an 8-year-old geek.
Happened to me at 9, same age as Rachel. Fiercely bad eyesight on my side of the family.
Well, you must have had fiercely red hair on your side of the family.
Yeah.
And I hope that's the worst thing that I pass on from my gene pool.
Well, yeah, I mean, it's not like she's going to go blind.
Jerry, weren't you going to check those labs for Mrs. Volpe?
Yes, I was. I am.
You over, Jerry. Where'd you say Carter is?
Suture. ER. Malik, where are you? Yeah, okay. I'll be there to help you in a few minutes.
I got it on my second call. One of the agencies I used with PCA on a cancer patient a few months ago. And Joy's health insurance will cover it.
Tell her about it?
No, I think you better explain it to me.
Joy, it looks like we're going to be able to provide that pain medication we talked about.
Now? Today?
Well, our home health care agency will deliver the machine to your house. The machine will be set to deliver a specific amount of Dilaudid every hour.
When do I push the button?
Whenever you feel like he's in pain.
How do I know how much to give?
You're not going to have to worry about that. There's only one booster dose within a 2-hour period. And then the machine will automatically lock out any additional dose.
Dr. Ross is going to write you a prescription, and I'm going to arrange with the Medivan to take you and Ricky home.
Thank you. Thank you both so much.
I just wish we could do more.
It's snowing again.
Yeah, about an hour ago.
Listen, Carrie, I've been thinking, and I don't feel comfortable with what I told you this morning.
Well, none of us are really at ease with the situation.
No, look, what I mean to say is I don't feel there was any harassment involved.
Well, that's not our decision to make. When the full committee hears the testimony, they
I don't believe I'll be testifying. I mean, if I'm not convinced myself, then I don't feel I should put it forth into an official record.
Elizabeth, did something happen today?
No, I just don't think there's any relevance to the incidents I mentioned. And that being the case, I think it's only right and proper that I should withdraw my statement. Look, I'm really sorry. Sorry that I wasted your time. I hope you understand.
Ready to go in here?
Yep. Labs are all okay. Upon physical exam, no significant findings in the head or neck other than the enlarged jugulo-digastric node in the right submaxillary area.
Okay. You want to do the honors, Carter?
You know, I've actually never done a neck biopsy.
Okay. Well, here's your chance. You ready there, Mr. Strauss?
Yeah. Okay.
So this VQ thing was positive?
Yes, which means that small blood clots have traveled from your legs. And if this condition isn't treated, a larger blood clot could lodge in your lung.
Yeah, well, that does sound bad. I'm going to have to get myself back here real soon
No,
and
no.
get that treated.
Alice, you need to be admitted today. And you need to stay for 4 or 5 days so that your blood can be properly anticoagulated.
No, my dogs. I can't leave them out in the cold.
I know, and I don't know what we're going to do, but I promise you we're going to think of something, okay?
Jerry!
Jerry!
Go! Go get them, Jerry! Get them! Gotta get them.
Mark? Ricky Abbott, the kid with ALD. His back, he's in pretty bad shape. I arranged for his mother to have a home PCA machine. I need you to sign off on the Dilaudid.
He's a genetics patient, right?
That's right, but he's down here right now.
Yeah, I can't sign off on that. He's not on our service.
I just thought it'd be easier.
Yeah, maybe, but that's their deal. You have to go up to genetics and have them sign off on it.
Yeah, you're right. Probably should have thought of that in the first place, huh?
Hey.
Hey, you have a breakout?
Yeah, something like that.
Okay, you're on. All set.
Okay, thanks. I'll give it to her as soon as I get rid of this little guy.
Jerry. Sorry, Dr. Green. Hi. I was looking for you.
Hey. I'm very sorry. I can pay for the curtain.
I don't care about the curtain. I was wondering if you're okay.
I won't cause any trouble, and I'd like to keep my job.
You didn't cause any trouble, and no one's going to take your job.
Thank you very much.
I do think that you probably have a pain in your back, and I'd like to help you if I can.
I think my back is fine. But there's something. I'm hoping you can give it to me.
What's that?
I believe it's called Viagra.
It's medication used for impotence.
I am impotent.
Carrie.
Robert, may I sit down?
Certainly. I'd offer you something to drink, but we don't have anything. The coffee
Did you
machine.
speak with Elizabeth Corday today?
She assisted me on an appy.
Is that when you spoke to her about Maggie Doyle's sexual harassment inquiry?
Why would I do that?
Maybe to stop it from going forward.
I am eager for it to go ahead. I'm looking forward to being vindicated.
Oh, well then you're going to be disappointed because the investigation's been closed.
Really? Well, I guess we'll all have to go back to our humdrum lives then, won't we?
Of course, all the testimony has been typed up. I've got it in a file.
Mm-hmm.
And the thing that really sticks out is that bad evaluation you gave Dr. Doyle. She's received such positive remarks on her other rotations.
So you're thinking that perhaps I was a little bit hasty and that if I spend a little more time on it...
Yes, I'm thinking that if you took that time right now, you might write something very different.
Uh-huh. Which you'd certainly be interested in reading.
Oh, absolutely. I imagine I'd want to put it in that file.
So, Balage, where are you from?
Nigeria.
Ah. That's a ways away from here. How do you like Chicago?
Okay. My wife does not like the cold. She works here in your cafeteria.
Oh, well, that must be nice. Both of you, watch my finger. Get to come to the same place for work.
Mm-hmm.
Okay. We need to pull the gown down now, right? The burns seem to be well healed.
Yes, they're not a problem.
Had them for a while. You want to tell me how it happened?
No.
I need to examine below the waist now.
I understand.
You're in early.
I have no life.
Dr. Weaver, Sam Broder called back, said he would meet you at Doc Magoo's at 8 o'clock.
Thanks, Jerry.
That sounds like a life. Hot date?
Doc Magoo's.
Well, and even Dr. Weaver has her standards.
Thank you, Jerry, I think.
Dr. Green, path report's back on that med student Strauss.
Better let him know.
Sent that kid up to the OR. Hey, a minute?
Yeah.
I wanted to fill you in on something. Let's go in the lounge.
Sure.
I need to talk to you about the pathology report. You guys mind hanging outside?
No, they can stay. I already know it's crappy news.
The biopsy shows Hodgkin's disease, which is a form of lymphoma.
Oh, man.
You need to understand, though, that it's very treatable with radiation therapy. The chances of surviving are extremely high.
Look, can I just have a few minutes here, please?
Yeah. I'll check back.
Now, I've contacted a pet rescue group that can take all of the dogs tomorrow, but I need each of you to take 2 of them home with you tonight.
I can't do that, Carol. I got cats.
You have cats?
Yeah, what's wrong with cats?
Sorry, Carol.
Right. Well, I'm a dog person. I'll take 2 and 1 of Jerry. I want the little one.
No. Sparky is my man. Hey, Sparky.
I'll take 2 of the big ones. I'll take the little dogs.
What's up with that?
I'll take this Airedale if no one wants him.
Okay, great.
Carol and Joy, have it some fun for you.
Okay, listen, work it out amongst yourselves, and just give me 2, any 2, I don't care. Just tie their leashes to my locker. There you go.
Oh,
Thanks, guys.
Hi, Joy. It's Carol Hathaway. Wait, Joy. What's wrong? What? Well, did they hook it up? Can you tell if it's working properly? Oh, Joy. You need to calm down and just take your time, all right? Just take your time.
Initial lab tests don't reveal anything like diabetes, which may be related to erectile dysfunction.
I understand.
You're not on any medications that have that side effect.
No.
And if it was psychological, you could still have a spontaneous early morning or mid-sleep erection.
No, I do not.
I think it's caused by trauma. If you were in an accident or maybe even beaten. If your pelvis had been broken, internal bleeding could have compressed the arteries and veins, affecting the blood supply to and from the penis.
And if that is the case?
A urologist would probably want to do a vascular bypass operation to try to restore normal function. I think you should see a urologist.
Okay.
Where's Dr. Romano?
Lesson in the lounge.
Should make no decision. I didn't tell you that.
Was it you?
Sorry?
There were only a couple of names I gave Dr. Weaver. One didn't have anything concrete, and the other seems to have backed out. Was that you, Elizabeth? Did you decide to protect your own place in the food chain? Stay in the club?
Yes, I did. I'm sorry, Maggie.
Oh, sorry, my ass.
PCA machine isn't working, and they hooked it up wrong.
No, it's hooked up right. She doesn't know whether to give him a booster shot or not.
She thinks Ricky needs it.
But she can't tell.
Well, if she is in doubt, she should just go ahead and give it to him. I mean, I'm afraid it's not going to matter that much. I don't think he's going to make it through the night.
I told her we'd go over there.
I mean, why? She knows how to work the machine. What are we going to do?
She's all alone, Doug. She's really scared.
I understand. It's just, I don't know what good it'll do for us to be there watching her son die.
I know. I mean, I don't know. Probably won't do any good. I really want to be there.
Yeah.
Okay. I'll probably be home pretty late.
Mobalaji, they told me you were here. I didn't know what was wrong.
Kubi, this is Dr. Green. Dr. Green, this is my wife, Kubi.
Nice to meet you.
How do you do?
I strained my back, and Dr. Green was kind enough to take a look at it and give me some pain medication.
Yeah, it's going to probably be better in a couple of days.
Thank you. Sometimes he tries to do too much at his job. He works too hard.
Yes, I know.
I'll be fine. Thank you again, Dr. Green.
You're welcome.
You're the only man sitting alone, so I'm hoping you're Sam Broder, right?
Dr. Weaver, nice to meet you.
Call me Carrie.
My office tells me that you've made 3 or 4 appointments before and always canceled them at the last minute. I think I was the dentist.
Yeah, I'm sorry.
It's all right. It's pretty common. Making the decision to track down your birth parents is not something you should do lightly.
I've done that whole internet thing.
Yeah, most people start there. But I do this for a living. My company handled several hundred adoption cases last year.
Sounds like a good living.
I'm going to need your full name, date of birth, place of birth, and the names of your adoptive parents.
I'm glad you can step in on such short notice, Robert.
I'm always happy to get a 16-year-old up and running, get him back out there, kissing the girls, making them cry. So, how's this interim chief thing working out?
Oh, miserably. Between my surgical duties and all the administrative crap down there.
Yeah, it's a shame Carrie Weaver wasn't able to continue. And on top of surgery, you're chief of staff.
Oh, I tackled that part of my job around midnight.
Hey, didn't it work out fairly well when David Morgenstern was handling surgery in the ER?
Yeah, he did seem to have it down.
Well, then, Donald, I feel I'd be remiss if I didn't offer up my services.
To be interim chief of the ER?
Well, I think acting chief has a bit more je ne sais quoi, don't you?
I don't care if you call yourself Almighty God, if you're willing to take that on. Although we'd still be conducting a search.
Yeah, well, hey, as long as you need me.
Oh, I needed you today.
How's tomorrow sound?
Like a stroke of luck.
Sorry, it's only instant. There was a day I used to grind the beans.
Don't worry about it. Anything is fine. Stay here. I'll get it. Hi.
Mm.